We really appreciate everyone joining us today for this important conversation. And we are really pleased to bring this webinar to everyone today as a reminder of how important our collective action is for supporting the world's most vulnerable. And today we're going to bring you directly to the front lines of one of the largest refugee responses in recent history. And I know many people on the call know a lot of the history, but just to recap a little bit of where we've come. In August 2017, hundreds of thousands of Rohingya fled violence in Myanmar, and they crossed into Cox's Bazar, Bangladesh, creating the world's largest refugee settlement almost overnight. Entire communities of over 750,000 people arrived with little more than what they could carry. The scale and speed of the influx was staggering, and the humanitarian response has had to match that urgency. BRAC had no prior humanitarian large-scale response experience, yet drawing on decades of work in development and poverty alleviation, our staff mobilized within days. Hundreds of our staff arrived from across Bangladesh, simply showing up where they were needed. From those early improvised beginnings, BRAC has become the single largest civil society responder in the camps today. This is the essence of BRAC, always finding a way to bring dignity and resilience to the people we serve. So today we actually want to start by grounding ourselves in the voices of Rohingya refugees themselves. These are not easy stories to hear. They reflect the weight of displacement, uncertainty, and daily struggle. We believe it's important, however, to listen directly, to understand what's at stake. So as we watch, we invite you to hold the pain and the resilience in these voices. Because while other words may sound heavy, they are also remind us of why we are here today, to stand with them and to work together towards hope. So we'll play this video now.
आरा बर्मात आयदे टाइम माजे एडे इंजुकल नवाशिल तोले बांग्लादेशर पाब्लिक आरा साहाय्य ताय्य गुज्जे यार फरजायरे इंजुकल दुक्की तो दुगी ओरे बादे आरारे दासे ए मदर लेट्रिन गुसलखाना खाद्य गायरा इम बेगिन दासे ठीक-ठाक करे दिए तो गावांशो तू गारा से बारिया से दासासे आरा तिन दिले गारा शिल बारिया शिल दासासिल যারা তো 8 বছর পর্যন্ত আজরি বুঝি ক্যাম্প মাঝে তা বাজে আজ পর্যন্ত আরার ঘর দেশ মাঝে আরা যাই না পারি আরা তো মনে হতে এখন আরার দেশের মাঝে আরা তো যাই বইলা আরার ফোনেটে ফোন না করি না পারে সুন্দর করে তাকি না পারে আরা ঘর বাড়িলে তাকি না পারে নিলা দুঃখ জিন্দগি তো আরা যদি আরার হকান দিয়ে যদি আরার বর্মার সরহানি নিতে বলে আরার দেশের মাঝে আরা যাইতাম বই আরা এটা বাংলাদেশের মাঝে সেখানে না যাইতাম
জিনাতার বয়স হইলে 18 বছর আই স্কুলত নযাইদে জুলাইর 4 তারিখ ঈদ শুরু দিয়ে ইয়ালতি আই স্কুলত নযায় আর তুগা ইঞ্জিনিয়ারি বনিবাল্লাই স্বপ্ন ছিল যখন 2022 মাঝে বর্মা স্কুলে আঙ্কুলে আর 22 সালে স্কুলিং আঙ্কুলে স্কুলে আন্দাত খুশি না আই ভর্তি হই আজ জান আশা করছি স্বপ্ন দেখে আমি পুরা করে হাজুম বলি আই ক্লাস 7 লতি ফজি এর মাঝে ভর্তি হই जिनकी इंजीनियरिंग आय बनते चाय ए मेटेरियल दहाय दहाय गरी ना हारे तुलु तुले ना आरा दहाय ना हारे आरा बुझिन हारे सबक दे दिबा आरा तो फारा जागे আর মাঝে মাঝে স্কুল বেশিরভাগ বন্ধ করে ফেলে বাজেটও কমে যাবে ওই আরা বুঝি না হারি আমি পড়ি না পারি আর আরা 3 দিন পরে বাদে ইউনিভার্সিটির মাঝে কলেজের মাঝে ভর্তি হবার ইচ্ছা আসছিল এখন আরা সেটা নদীকির এর মানুষে বিয়ার প্রস্তাব দেয় ওরে অবিবাহিত মায়া হওয়া তাকে না হারে নির্যাতন করে লই যাইতেছে আর মা বাপেও যখন বিয়ার প্রস্তাব আসে বিয়া দিবলা রাজি আর মা বাপ তো এখনো মন দেয় আর ফন্না খাই বলে আর তো ইচ্ছা দেয় এখন ফন্না ফুরি বললাই জিয়ান নাকি স্বপ্ন দেখি আমি ফুরা করি বললাই ইয়ান দল্লা গড়ি না হারি এর অবিবাহিত মায়া হওয়া তাকে না হারে তুলে লই যাবে
I want to become a community leader because I want to change my community and I want to raise awareness for my generation and equal right for my generation and want to stop uh, early marriage, and also we want to turn our pain into power and my dream into reality. In this refugee camp, I am facing different kind of challenges and difficulties. As you know, no good education system, no good water system, and here in the refugee camp is very overcrowded and it's very difficult to spend a life in the refugee camp. And most of the people live over the top of the hill. And sometimes, whenever the rainy season come, at that time this landslide happen and die a lot of people. At that time, I can't tolerate the pain of deer. That's the reason I am raising this voice.
Those are really heartbreaking, and there's a lot more of those stories on the front line. And so many of BRAC staff hear those on a regular basis. And so while those voices remind us also of the urgency, our panel today is here to share a different perspective. Our three guests from BRAC experience this on a daily basis in working with and inside the camps over a period of years. And so we have with us Cam Morshed, the Senior Director of Advocacy, Innovation, and Meal at BRAC, who has decades of experience working with the UN and in policy change and in shaping partnerships. We're joined by Dr. Akram Islam, the Senior Director of Health and Humanitarian Crisis Management at BRAC. Akram is a global expert on communicable disease, public-private partnerships, and scaling up health, WASH, integrated programming, in crisis management. And Dr. Sharmin Sultana, the program manager for BRAC's Health and Nutrition Interventions. She is in the Rohingya camps at Cox's Bazar and leads the planning, coordination, resource management, and emergency response, as well as stakeholder engagement. So to get us started, I'd like to hear from each of you. Can each of you just share briefly one thing, one person, or one story that's bringing you hope for the way forward in Cox's Bazar? I'll start with you, Cam.
Thank you. I know the video you've just shown leaves all of us with a feeling of helplessness. But, I feel more hopeful now than I was even 2 years back because right now people are started discussing how we can adopt a development-like approach, something that we have been advocating for years. That's about removing duplications in service delivery centers, streamlining the job description of the people working in the camp, and something as simple as, for example, removing the simple in-kind based response to in-cash or cash-based responses that can reduce the cost, improve effectiveness, and also accountability of the services. As the saying goes, you can't keep doing the same thing and expect a different result. The triple crisis that we've just seen, growing need, declining funding, looming security crisis, needs a new way of thinking, and still changing how we work, especially changing programs, is slow and tough. It's about changing the practices and so on. So I was starting to worry that we wouldn't make the shift in time before everything falls apart. Now I'm feeling a bit more hopeful. Senior UN bureaucrat has started now discussing with us with more seriousness and urgency. Government functionaries who were once very rigid in terms of their approach has started discussing flexible approaches. Political leadership is now more open, and especially the UN sideline high level event that happened yesterday at least show me that there's a global resolve to solve this problem, tackle it in its entirety. So that definitely makes me hopeful. Thanks.
Thank you. Akram?
Yeah, thank you. So, as I've been, overseeing the response from the beginning in 1917. So I see this is a lot of power and willingness of these people in the camps. In the beginning, the people are basically involved more on the response mechanism, serving the emergency responses only, while communities in the Rohingyas also participating in the response together with these people. But all in the last 8 years, we have been seeing this, one of the important area of the power of the Rohingya people, particularly in the camps. As we know that the higher education, particularly college and university, as you've seen in the videos, are not allowed to these young boys and girls. And then they have many young boys and girls really like to grow their own career and allow new things and contribute to their own communities, and also this very strong, meaningful contribution they like to do their own families as well. So when we started in the last couple of years thinking about how can we support these young colleagues who really aspire their own futures and would like to serve their own communities, so we basically open up the English learning courses, and then also give the opportunity to the IELTS exam, in collaboration with the British Council. And also we often skills training on the particular in the different issues, but also including the computers. These young boys and girls really, they just grab this opportunity, So it feels me very strong in terms of that. They really like to change their own community. They like to change their own life, and they really like to meaningfully contribute to this inter-responses. And as you heard this, the stories in the video. So, and then these boys and girls are also being participating in these courses, and also appearing the IELTS exams. You'll be surprised to know that many of them have very good scores, and they've been engaged in different way of, building their own communities, the connecting with global communities. And we are basically hopeful of very much that we really like to connect these young colleagues, young boys and girls to the global community for the own development, for their own societies. I think these are kind of great examples after having a lot of complexities, a lot of, the government doesn't allow many of this, the livelihood opportunities for them. And so, but they really tried themselves best that I've been seeing. So it gives me a lot of, energy to work and with committed and devotion, and along with my colleagues joined here. So I'll stop here. I'll
Well,
share.
and thank you for your long service and support of this, being there from the beginning. And Dr. Sharma, would you like to share your message of hope?
Thank you so much, Julia. So beside introduction to the audience, what you have seen in my background is a primary healthcare center that is located inside the Rohingya camp, and it provides health service for 24/7 basis with the necessary human resource such as doctors, nurses who does the 24/7 basis duties. So when you are asking about hope, the hope that brings to us is the community people themselves. So in that case, I want to share a small story from the community so that I can express my motivation, what we are actually motivated to. So the story says, Journey of Care. Noor Kolima, age 21, who is a Rohingya girl, born in 2004 in a small village of the Myanmar. She was living with her parents in Myanmar, in a family of 7, with her parents and 5 siblings. She attended school up to 5 in Myanmar in a government school. So back in 2017, when the violence started in the Myanmar, Noor and her family was forced to flee from the Myanmar to Bangladesh. Before fleeing to the Bangladesh, Noor's mother just delivered a baby boy 17 days before they arrived in Cox's Bazar, Bangladesh. Despite the trauma and the displacement, Noor was determined to support the community. So Noor began her humanitarian journey with BRAC in 2019 as a WASH volunteer. Later in 2022, Noor started working as a community health volunteer with the health and nutrition program of BRAC. She got the training of basic health emergencies covering the essential topics like the maternal and child health care, disease prevention, and communication skills. After the training, Noor started conducting the household visits where she disseminated important health-related messages, build strong relationship with the community members, building trust, and taking the community awareness sessions. So over the time, Noor had a very good relationship with the community members, of which is the community people of her own. One day, during a household visit, Noor met an woman named Shofika, 33 years, woman of 5 children. During the discussion of the family planning, Shofika shared that she has a concern of missed period for last 2 months, despite her having a husband using the condom. Noor immediately took her to the health facility. After the lab investigation, it was confirmed that Shofika is pregnant again. Noor didn't stop there. Noor make her accompanied and introduced her with the midwife so that Shofika can get all the services that is necessary during the maternity period. After that, on an fine morning of August 11, 2025, around 6:30 a.m., Noor Kolima got a call from Shofika that Shofika's husband is away and she is having a labor pain. So Noor rushed away immediately to her house and accompanied her to the health facility, BRAC health facility, where after trying of the medical service providers, Shofika was able to give birth to a healthy baby boy after 7 hours of trial. And Noor Kolima was always accompanying her throughout this journey. After 2 days, Shofika left the health facility with a heart full of gratitude to the health service providers and obviously to Noor Kolima. After all this, Noor says, this was one of the most rewarding experience of my life, helping a mother delivering a healthy baby throughout her delivery journey. That's why I became a community health worker. So this is the hope I get every day while working with these people and while working with this community, for building more trust, for improving the health seeking behavior among themselves. That's what motivates me every day to work more. Thank you.
Thank you so much. Well, and if I can just add to this, I think what's amazing to me is the energy and perseverance that, you know, the three of you and everyone else in the response have. And I think that since joining BRAC, one of the most sort of motivating factors is like our, you know, our collective commitment to always do better. You know, we recognize where we could do better, where we could do things more cost effectively so that we can reach more people. And we're just unwilling to stop and just do, you know, maintain our level of service, but we want to provide better service and we want to reach more people. And so I thank each of you and all of your teams. So if I can just shift a bit here, Morshad, you were with BRAC during the very first days of the crisis as well. Can you take us back to those early days and what led BRAC to actually step in at that moment, and what keeps our staff motivated, you know, this many years later?
Thank you, Julia. Let me take a step back and say, you know, when this crisis began, even before that, BRAC, though started as a humanitarian organization, it graduated into a development organization with the, you know, Bangladesh's hope and aspiration. So when this crisis began, we were a little hesitant whether we should get engaged, whether we have the capacity to do it, and so on. And the scale was overwhelming. You know, we sent a small team, and the team came back and presented a horrible story of crisis, devastation, death. So we talked with our founder, Sarabed, at that time, and he said, don't wait, go do whatever you can, because BRAC is about helping people in need, doesn't matter which country they belong to, and so on. So, and also the board approved the first $10 million US from our own fund to the crisis. And so we knew, you know, if we didn't act fast, the Rohingya community would suffer, but more also critically, 35 years of work that BRAC has done in Cox's Bazar will be, will be undone. So, so our first team after the scouting mission went within 4 days, led by the then executive director of BRAC. I was part of the team. Akram Bhai was also part of the team. And we were really stunned. We had no idea, even the 4 days between the first scouting mission and our mission, the situation deteriorated drastically. It escalated so fast. And we realized we needed boots on the ground first. That's the first order of business. So at 4 p.m., almost the end of the office hour, we called our offices in all 64 districts and told them that, please release whoever is willing to come to Cox's Bazar from their respective duty in their offices. This is not new, by the way, in BRAC. In time of crisis like flood, cyclone, as you know, Bangladesh is a crisis-prone country, natural calamity-prone country. So, and similarly, we just asked them, you said, you have seen what is happening in Cox's Bazar and we are in Cox's Bazar. Please release whoever is interested to volunteer to come. And, from the next day, almost noon, people started pouring in from different districts of Bangladesh. Approximately 400 staff reported, some after doing 14 hours of bus journey. They just came down to Cox's Bazar, reported for duty. So and I was quite new those days in BRAC, so I asked why. And I realized this is exactly in BRAC's DNA. We show up, we act, we care. That's BRAC. And we didn't have proper, places for them to stay. We never planned for 400 people. Some colleagues told me afterwards that they knocked on doors in the rain in neighborhood and basically asking, can we have a dry place to sleep? And some actually slept in a stable, neighborhood stable for that night. So now, if you ask what keeps us going, we did, because that was our DNA. We started. Now 8 years on, we are still doing the same thing. Though BRAC is an international NGO, we started in Bangladesh. We are a Bangladesh-based NGO. So as the crisis drags on, more and more global actors are shifting their focus to new theaters like in Ukraine and other crises. We realized we are here to stay. We have to stay. It's our responsibility. The Rohingya and the host community still need us, and as long as they need us, we cannot go anywhere else. So as you know, there's this saying that in a bacon and egg breakfast, the hen is involved, but the pig was committed. And we are the committed folk here. We cannot move from here. That sense of responsibility is one of the things that keeps us going. But also the DNA, the spirit that we carry, that the commitment that we bring is also keep us going to make even bigger impact, even taking more responsibility as international actors are receding from Cox's Bazar scene. Thank you.
That's quite remarkable. And every time I get the chance to listen to you or hear from you, I learn something new. So thank you for sharing. And I think from those early days, we're now 8 years changed. And huge thanks to all of our donors and supporters on the call that have stood with us from even those beginning days. And because of that support, BRAC has been able to support almost 1.3 million people in 2024. That's just staggering if you think about that. And this is across both the Rohingya and the nearby, what we say as host communities, and which represents all 33 camps that we work in. And we provide services for education, water and sanitation, health and nutrition, child protection, shelter and site development, food security, livelihood, skills development. And again, this gets at the BRAC way, where we try not to run pillar programs. So even if donors support pillars, we try to integrate that so at the level of the client or the person that we're serving, it can feel like a holistic service. Because just like us, we can't be treated as a health issue or an education issue, but as a whole household issue. And we've always maintain that focus. We don't take a sort of cut and paste approach. We really listen to the communities, shift as we can, and make it as responsive as we can. So I'd like to pose a question to you, Dr. Sharman. Can you share a bit of your experience in the camps and what drew you to this work? And how do you maintain hope and motivation?
Okay, thank you again, Julia. So when I first began working in the Rohingya camps, the health landscape was different. The health needs was different. So our focus back then was mostly entirely on emergency management, treating the traumas, managing outbreaks, and preventing basic health emergencies through the mobile clinic. So over the year, the profound shift has been occurred in the Rohingya camp. Today, the Rohingya community's health needs has been changed, and it has been moved from mobile clinic to 24/7 basis service, which taken it to the ultimate and upgraded expanded healthcare services. So now we are seeing a rise in non-communicable and communicable disease pattern over the year, and mental health need is increasing. Almost 61% of the population are currently requiring the mental health needs. Access is still barrier for almost 22% of people. Immunization gap is still persisting. 22% of children are totally not fully immunized in the camps, and maternal mortality is standing for 168 per 100,000 live birth, which is still a concern for us. Additionally, malnutrition is increasing in the rate of the wasting and stunting day by day. So it is also increasing the health demand in the Rohingya community, specifically for some specific cases in terms of higher secondary and tertiary care, the referral service, and basic emergencies like small surgeries and all that is not manageable inside the camp. So these needs are increasing day by day. But still, the health service has been improved a lot over the year, because almost nearly about 50% of female currently want their children to be born and in the health facility rather in the home. So we are hoping, we are keeping this motivation on to reach to the sustainable development goal and meet those targets through the funds availability and a cost efficient method. And obviously, we have reached to that point after 8 years where we can say that health system is working good in the Rohingya camps, and this could not be happen without the donors who are continuously supporting us for reaching at this level. So the donors contribution have helped save building trust, and laid the foundation of the long lasting and resilient health system. So I'm just taking a moment to express my gratitude to the donors for being with us.
Thank you for
Thank
that.
you.
And I think I'll call out here just so that we have all sort of a point of framing with regards to the nutrition and food security. And I think that, you know, while a lot of people understand the development policy changes in the US and in Europe, and the funding changes that have happened on the ground, I think one of the most instrumental or impactful that I've heard from you is obviously the reduction in food aid, and we've seen that voiced in the global press. And so whilst, you know, BRAC was making and other community support organizations were making really good headway with food security, this drastic cut in food aid has had a really, you know, a difficult impact. And so, you know, with that, I know that the situation is incredibly complex and it's constantly changing. And of course, it can be political too. And Dr. Akambai, I'd like to ask you, you know, with regards to continuing to provide, you know, this holistic solutions at scale, you know, I'd love to hear a few more of your thoughts on this, if you could share.
Thank you. So as my colleagues also said, in BRAC, basically, we learn by doing. So that's one of the principles that we have in BRAC. And how do you learn? Basically, learn from the community that we served in. And here, in cases of the Rohingyas, because we learn from them, actually, you know, that's their inspiration and every day, every morning. And while doing the business in the community, we also feel that we really need to work with them, you know. it doesn't need that. So we are doing the things and learning from there, but really, basically, we need to work with them. That's the basic DNA of the BRAC. So engaging community, give the scope of meaningful participation in their own community development. So that's the basic principles of BRAC. In the development program that we practice very much, So while we are in the Cox's Bazar, in the early days, it was more a rapid response mechanism way of working, mostly. But the last couple of years, basically, we're talking about this is not, sustainable in the long run in the crisis context where this is being protracted nature now. Actually, is 8 years now. So we have been pushing our thoughts and ideas that we really need to work more integrated approaches, not just silo sectoral approaches. We need to bring the sectors closely, to have a maximize the outcome and synergies among themselves. And we really like to work with the communities to engage more with their serving their own community, to give them more ownership of the response, rather than from the outside you go with this community that they've been. So with these basic principles, we start discussion with UN agencies, development partners, the donor agencies. But the last 2-3 years, there's a lot of good appetite from the different corners for. Of course, this is one challenge we faced, because there was a fund flow, international fund flow was there, so there was a often tendency for the sectoral process. But the last couple of years, when the reduction of the funding, that also give an opportunity to talking with the different partners on the grounds, how can I bring closer every sectors. So that is where basically we are moving on more on a development process, integrated delivery mechanism, and more on durable and sustainable solutions. Let me give few examples how we are doing this business differently in terms of development process in the humanitarian context. For the early childhood development, which is the play to learn, is under the child protection sector, while the learning centers for the children from age 5 and above is under the education sector. So these two sectors doesn't talk actually each other. So they parallelly plan, So one just do the play to learn learning centers 3 to 5 years, and then they leave the children over there. There's no connectivity with the children to the learning center. So we challenge this with the sectors and donors. This is not the way of you thinking about it. It's kind of where the children's growth start from when the mother is being pregnant, and then the gradually children grows and then thrives. So that's why we convince both the sector, child protection, education sectors, need to be continuity of this, the growth and the learning together, so that you can have a very strong human resource base in this even crisis settings, So this is similarly, WASH and health doesn't talk with each other because they have a very sectoral process. But if you look into these hygiene issues, if you don't give a hygiene education, your health problem will remain there, because it's communicable diseases are basically linked up with your hygiene educations, poor quality of the sanitation, poor quality of the water. So it looks, you didn't talk with each other. You need to plan together. You really just can't build your toilets and tube wells and then just come out from there. You really need to work together with your health facilities where these diarrheal cases, patients are coming in. Go back and fix these problems with the sanitation one. So you need to really work with these two teams. And that's the way basically we have been bringing all the sectors, and then very recently we are working with this UN, particularly the UNHCR and European Union, having a more integrated approaches in 4 camps. And while of course is earlier stages to bring these ideas on the context, so there might have some the learning process during this next 2 years journey. But this is a good thing that people has accepted it, but the government has endorsed it, approved it. I think this is the way that we need to bring this, going forward on the ground. The second part, what I was also thinking to talk about it, as you know, this UN General Assembly just recently have a high-level meeting on the Rohingya responses over there. And a lot of discussions happens. The development partners has a quite a strong focus on the new funding mechanism. But also this gives an opportunity for discussing among ourselves. This is with the renewed commitment with this global community, but also being, this synergies between the actors on the grounds may make a maximize this effort, So that's maybe one way that we can reduce the funding gaps that we have it, particularly on the ground after the US funding cuts. Because what I'm saying is it's not the funding cuts also, because it's a hugely densely populated camps. It really can't, living conditions really poor. In a single family uses only single houses, one room for a family. Can you imagine it? It's teenage boys and girls share the same rooms. There's no space for the new, households. This year also added another 125,000 Rohingya people. So you really can't think about the living situation in the countries. And this being also affecting the young adolescents, girls, has a lot of risks for the violation of the camp, So this gives a really a big challenge for us to delivery on the ground. So I believe this is the right momentum. And then with the support from the different partners, donors, communities, to design a program that's really needs give a better delivery mechanism, maximize the effort, and we can get more better results than with the limited resources. So I think the delivery mechanism that we have been working with, that integrated delivery mechanism, frontline workers coming closer, instead of the two frontline workers, you really need maybe one frontline workers just to address a few things. It's very similar to the protection. And I'm really happy to say, share it here. Now the UNHCR is basically three protections coming together: the gender-based violence, the community-based protection, and the legal. So they're now been coming together. So the idea we flawed in the last 2-3 years is coming to reality at this point. But now we really need to move from here to the next level of the delivery, and then practice on the ground and learn and then change what the needed for fine-tune this model on the context. So I will stop here. Perhaps we'll have more time for Q&A.
No, thank you so much. And I would like to, since we do have time, open it for questions and answers. And I also want to recognize amongst us a frontline worker, Mohammed Rafiq, in the chat. You've identified some really important points on what's working well in the camps. I don't know if you can go off mute or if you'd like to intervene or say anything, or if you'd like to voice any questions you have, but I'd like to give you that space. And thank you for all of your commitment on the front line and working in this each and every day. I would invite you to come off mic and introduce yourself if you want. No pressure if you don't want to. We're seeing a lot of your great feedback in the chat.
Okay, first of all, thank you so much for giving me this opportunity to express something about me. I'm Mohammed Rafiq. I'm a refugee survivor. I have been working as a community para counselor. It's been 7 years gone, and also I still continue. So I'd like to express something about the crisis of the Rohingya refugee failure. Especially recently, the UNICEF closed the learning center. For that reason, most of the Rohingya children are isolated and also depressed and also hopeless and helpless. And they can't get any safe space and also can find any healing place. And also many types of challenges they face. Apart from the older people and also youth. So is there any option? Is there any opportunity for the children to provide the administrative support, specifically the children who can't attend the LC learning center and also can't get the healing space? My first question is that, and also the second is, many of the Rohingya youth can get access to for higher education. For that reason, many of the youth getting involved in different terrorism. Due to employment, the terrorism is increasing. So if possible, can something, and also I hope will be great something better. And also at this time actually I'm not feeling well at this time, so I can express maladies. And also I frequently meet with the UNHCR and also talk about the crisis of the Rohingya refugee and also MS faces the process and also a lot of challenges of the Rohingya community people. So sorry, I can't express
Oh,
anything here
thank
because I'm not feeling well at this time, physically and also emotionally. You know, last night I was not able to sleep, and I couldn't sleep, and also at daytime because due to so many work I had to do for the reason. So I'm
you.
extremely sorry for that. Thank you
Thank you.
so much.
Thank you so much for your for all of your work, and it's incredibly hard to do that every day. So thank you very much. Um, Cam, Morsha, do you want to take? I think and I
Yeah.
didn't hear you maybe quite as well, but I think one of your questions was on access to higher education for
Yeah.
the pathway to employment.
No, the challenges that Mohammed Rafiq has mentioned is associated with funding and programming issue. Like due to the funding cut, UNICEF has had to stop all the learning centers, and so 120,000 children is now without schools. So that's the reality. We are currently discussing how to reopen it, and we are hopeful that we probably have the funding in soft pipe. So, but it's a temporary solution. Next year you will face the same situation. If there is no more funding, then the education, whatever education that we can provide, because this is not even the full education. The learning centers is not really high quality education. Even that will be restricted. And this is a situation which we are trying to overcome, but and it's so cost effective to keep a child in the school. You just need $80. With $80 per head, you can keep a child in school for a year. Even we don't have that money right now, and because we could only mobilize around 40% of what was needed for the entire year. Now, as Akram Bhai was saying, if we were allowed to change the programming modality and so on and so forth, then we could have do more with less. But still, 40% is way too low. So, and we take some hope from yesterday's discussion in the UN to see whether we can get more international support. But without that level of support, it's really a situation that requires that's almost leading to a crisis. Thank you.
I'm sorry to hear about that reality. Yeah, absolutely. I mean, I think while BRAC wants to look at, like you're saying, finding cost efficiency so we can meet more people directly at the same time, if there isn't some replacement of those funds, it's going to be hard to extend it. And I think for a lot of people on the call to realize that something like $80, and if we can make that more, cost efficient over time, can really change the life and education opportunity for someone. Like that's really practical. It's really tangible. I want to offer anyone to come off mic if you have any questions or comments from anyone else. Oh, I think we have a question that says, in addition to financial support, what else can someone who is not directly involved on the ground do to help?
Do you want to take more question or
I think that's the only one I'm seeing right now.
Okay. Yeah. So no worries, Rafiq, but we understand what you were saying. And the question is, what else? I think else is this crisis, and this is a reality that it started 8 years ago. Things started to fade in the memory of people. This has become a number in many people's mind that 1 million here. These are humans. their real stories, these everyday challenges, like Mohammad Rafiq was explaining. So one thing that we can all do is really keep this issue alive, help the government, the people who has the power, to keep them aware that, look, there is more than 1.2 million people anguishing in Bangladesh who doesn't have enough to go by. And Bangladesh is a country which is not among the wealthy countries. While the water crisis in the camp is critical, the same crisis exists in the nearby host community because they share the same water table. So keeping this issue alive, asking those who have power to do something about it is, I think, also critically important. Thank you.
Dr. Sharman or Akrambai, do you have anything to add to that?
I think most of that covered, but I think one important thing is that, this, of course, this funding crisis is one of the big issues, but I think we can contribute a lot on other way around, So particularly, if we reduce our, expenditure, that would also help to cover some things or efficiently. But on the other hand, I also try to, get understanding from this two questions that we really need to work together on the grounds as a problem solver, as a solution, the part of the solution maker. So I think I appreciate both of your participation, but really let's work together to find a solution on the grounds, because we will not get the solution that really require limited international funding sources, but while we can bank on the more national responses, while we can depend on our own internal community contributions, that is not being tested yet. So maybe let's work on that, how these communities can contribute more on responses. So as you understand this, the funding reduction is being gradually being decreasing. So that is need to work together to find some solution on the ground. So that will, let's work on that. But I thanks that you did very good job and as a mental health providers. Yeah, appreciate it.
Yeah, and I would also say, again, like coming back to the question beyond funding, and I think it's those practical ways in which we can all follow this, right? And we, whether, we've got a lot of people joining the call here today that are from the US or from Europe. There's a lot of discussions happening about international development, and policies and changes. And I think that there's a lot of discourse on whether there is a way forward, whether we can be effective. And so I think adding your voice to those conversations, being able to highlight that there are practical ways forward, that whilst there are challenges, there are solutions. And, and in particular, there are definite, like we're saying, whether it be UNICEF and advocating and following that conversation about extending education, or it be on food aid, like those are some of the principles that really do change the cost of delivery per household. And so as much as we can each individually join those conversations, share stories of success, because there are solutions that are working, and encourage those workers that are on the front lines as much as we can. We can definitely do that, in addition to advocating, like you're saying, to people in the positions of power, or the people in decision making with that do have access to funding, et cetera. How can we influence them and give them the hope and the trust that they can have a really effective response themselves? They can support programs that can be effective. And so join the conversation, raise your voice, and advocate to those that are in power. So I don't know if we have a couple people raising their hands. I encourage you to come off mute and ask your question. Oh, well, we do have one question that came in the chat. When you look at BRAC's work with the Rohingya community, is there one action, one result, or one project that you are most proud of? And Dr. Sharman, let me start with you.
Oh, thank you again, Julia. So the one thing that we are most proud of, that engage engaging anything, any community members in anything, like from bringing them to the health facility in any kind of emergency response, in emergency preparedness, disaster response, and any other kind of thing. When the community people get the accountability in the first hand before any of the organization or any of the agency response, that is the most thing we are mostly proud of.
That's fantastic. Akram, Morsha, do you want to join something? You want to add something you're most proud of?
Yeah, maybe Morsha Bhai, you can go. Yeah.
Okay, I can go, but I think this is we are proud of, but this is BRAC. We see development differently. We do development differently. For example, we are talking about falling cost. We're talking about cohesion and so on. But we're not sitting idle. We're doing three things I must mention. One is, Akram Bhai talked about we started a project with EU to deliver the services completely in a different manner, where you reduce the cost drastically, but improve the accountability mechanism and involve the Rohingyas, as a key delivery agent. The community-led development that BRAC practices, we're trying to do it. And as Akram Bhai said, we're very happy that government and UNHCR and EU agreed us trying to do that. That reduces the cost. Second thing that we're doing effective, what you call localization. BRAC is helping 27 other national NGOs, smaller NGOs, to deliver the service. So we provide them we actually offered the risk management services to the donors. So the donors give money to us, and through us, 27 NGOs are working, and they're delivering services at a much, much lower, like all Bangladeshi NGOs deliver 30 to 40% lower cost than what you have the international actors services. That's what the second thing that we're doing. And third, we are really, really trying to push the livelihood as a viable option, both the policy level, but also, as you know, for example, we have people working in the camp, and the product that they produce are being sold at our stores outside the camp. We recently opened Arong, the largest lifestyle brand in Bangladesh, a store in Cox's Bazar. So in Cox's Bazar, you can find a Rohingya corner where the Rohingya arts and crafts are being sold. So we are trying to go all out to give them also this is about a question of dignity. Why would you fully depend on, relief when you can work and you can earn? So these are the three things that we're trying to do to revise this or revisit the entire paradigm and make it a sustainable response, if you may. We're not saying we're looking for, the Rohingyas are going to stay here indefinitely. Everybody is saying the Rohingyas themselves want to go back, but until they go back, they need to have a life. And, that life needs to be fulfilling in its own right. And that's what we're trying, and that's what I'm proud of. Thank you.
Thank you so
much. Yeah, maybe I'd add 1 or 2 points here. So one very important thing that there are many issues that I'm proud of, but one key issue that maybe I will add here, in the 17, 18, 19, the camp was really dry, the no trees. But if you go there, it's green. The trees are there, the vegetable gardens are there. Every household, if they have a small piece of land in front of the door, they have now a vegetables there. So I think if you see the power of the people, the utilization of the resources, that whatever they have it, so you can see this grant. So that's remind me every day that's how powerful this population is. The second part, what I really see, sometimes we also with this context, people may not have more kind of the capacity for the innovations or the doing the especially many embroidery are being sold, so their quality is almost the same as others in host community. So it was in the beginning that many people said no, they don't have that, But you will be surprised to see many products are coming from.
Oh gosh, Akram, I think we lost you for the moment, but thank you each for sharing
But
those.
let me just add one sentence. Is in BRAC, we talk about turning camp into community. Camp has this own derogatory, vibe with it. You don't go for encampment, you create communities.
Yeah.
And that's, as a developing organization, that comes naturally to BRAC. And that's what we're trying to do in BRAC, and that I'm really proud of.
Thank you so much. I think that's a perfect note that we can shift. And I think what was one heartening thing for me when I was there and looking at the play labs or the early learning labs, which even gets back to some of the interventions that was shared earlier, that this young boy who saw his teacher, who was a Rohingya refugee, as a teacher in his classroom, and it gave him this hope that he too could become a teacher. And I think, like you're saying, it's that sense of community. It's making sure that there's dignity, that the leaders in these communities are Bangladeshis working alongside of Rohingya, and creating that sense. And so I thank each of you. We were going to ask Akram Bhai to share a little bit on just ways in which people's, which resources, like you shared earlier, what it costs to support a child's education each year. But Moshe, would you maybe share a few more examples of what, giving looks like in reality in the communities?
Akram is back.
Okay.
Yeah, Akram.
Okay.
Oh, sorry.
Your turn to talk about what, what does the money can do in camps?
Yeah, just giving people an idea realistically of what their support looks like, right? When it gets to your work.
Yeah, so as we talked also this, if we have an $80, we can basically, the teach students for a year. So very similarly with this similar amount that we can also support an individuals for a kind of a homestead gardening, But as you know, this, if we deliver through the BRAC, the cost is much cheaper than others. So if we invest more on nearly around $400, so we can have this basically is skill development training so that they can have their livelihoods, the opportunities in the different way. But if you have $100,000, $125,000, we can basically invest nearly around 7,000 to 8,000 population's health. So depending upon the contribution that we get it, but really, really grateful that, and we will be much cheaper than any other agencies on the ground because we have been working closely with the multiple sectors, more integrated way, and also being, engaging community to deliver the things rather than, from the outside we do a go and delivery. So we are more and more, delivering through the communities that they've been serving, So you have a different way of, but yeah, thanks for all the support that you've been given by the donors and partners on the ground. Yeah.
Well, and I just want to make one, again, BRAC doing things a bit differently than others. I just want to also relay to all of our supporters on the call that 100% of your giving and those that give to this cause at BRAC goes directly to programming, 100%. So when we talk about some of these donations and what it can mean on the ground, that's exactly how much the program has to implement, and that's something that BRAC feels very committed about. So cognizant that we're at the hour, I knew it was going to go too fast, and it did. But enormous thanks for each and every one of you that joined, and also to our three panelists. You each shared your moment of hope and pride, and I think for each of us, your work motivates all of us to do more and to do development differently. So thank you each so much for being with us today. Thanks to anyone that joined us. If you have questions, if you want more information, feel free to reach out to our team. And we love to hear from you, and we greatly appreciate your support.